Okay, so we're group 7 and our research topic is STDs and the surrounding stigma and prevention of them. My name is Desiree Torres. My group mates are Tiana Fisk and Jimena Serrano. The big picture, the main issue is that the stigma surrounding STDs and how we can prevent it. We're specifically looking in the Fresno area, and we will include an understanding of the related issues that cause stigma around STDs. For our project, we will compare the income of surrounding counties with Fresno County and if they've all had sexual education available to them. We will be drawing connections between this work and possibly conducting surveys. This is important because when people are informed of their sexual health, the greater the chances are of removing these sexual diseases and infections so that we can be healthy. We will be comparing STD rates in different counties such as Fresno and some surrounding ones. So what we know so far is that the main research we'll be doing is the correlation of rates of STDs in different counties and that of Fresno's. The purpose of this study is to understand the stigma created around STDs and if there was any type of sex education given to students at a young age. What we need to know is how the rates of getting tested actually affect the rates of these diseases in a positive or negative manner.
I'm Tiana, and our research questions are there differences in the rates of STDs in lower income areas versus higher income areas? And we predict that there will be a greater prevalence of STDs in lower income areas. We are also wondering if there is a difference in the rates of STDs in females versus males and why this could be. We predict that there will be a greater prevalence of STDs in males. We were also wondering if there is a difference in sexual health education programs in these areas, and how do these programs affect the rates of STD spread, if they do at all. Our proposed research data approach is that we will be looking at previous data sets and seeing how STD numbers compare between the areas of higher versus lower income. We will be looking at previous data sets and seeing how STD numbers compare between males and females in these areas and deciding whether or not this simply has to do with the population or if it is the result of underlying issues like sexual education in schools. We will be looking at the schooling programs in higher versus lower income areas and seeing how this has affected STD rates if they do. From this, we will then decide what has caused increase or decrease in these areas and how we can better prevent STDs in the future.
We've concluded that our findings show that at least in California, as of 2016, instructions of comprehensive sexual health education and HIV prevention are required. So we know that sexual education is available and is given to students. We also found multiple sources that gave us the information about the STD rates in Fresno County. And these are our references.